Hello, dear students and esteemed learners. Welcome to my course on Sociology of Health. This is our 15th lecture and the last lecture of the course for the third week. So, in the third week, we are dealing with the topic or the theme medical pluralism and health behavior. And in last 4 lectures, in this third week, we have covered multiple aspects related to medical pluralism. We talked about biomedicine, and then we talked about traditional medicine, complementary medicine, alternative medicine, and then we talked about Indian systems of medicine, which included Ayurveda, Unani system, Siddha, and all other systems which are broadly referred as Ayush. Now, we are going to talk about health behavior and its relationship with medical pluralism. We also talked about in one of the lectures previously the different categories of or approaches to medical pluralism, which are often identified as social medicine, community medicine, etc. Right? So, one question that may come to your mind naturally by now is this, that why do we need to have so many different types of systems of medicine? Yes, you also know the answer of this question. However, there can be several other things that we can talk about to answer this particular question. In this last lecture for this week, we will try to cover few important topics which I have covered in this lecture, and we will talk about healthcare behavior, then socio-cultural factors influencing health behavior, health seeking behavior, major types of healthcare approach, and then the relationship between health behavior and medical pluralism. We will try to conclude this week's course by the time we will reach to the last slide. So now we are beginning the topics that I have included in this lecture. Healthcare behavior is a very important topic that we have been referring to in various lectures also. So we will try to understand what do we understand by healthcare behavior. Healthcare behavior is profoundly influenced by cultural norms and values. Cultural attitude towards healthcare systems, treatment modalities, and healthcare providers significantly impact individuals' decision to seek medical care. So, people develop a specific type of health behavior and healthcare behavior when people are in different states of being in the trajectory of illness, sickness to disease, and then seeking treatment. As we discussed in some of the initial lectures, the trajectory to seek healthcare is basically passing through several stages or states. And during this journey, the healthcare of the persons concerned become very important because it depends upon the type of or the kind of engagement that the person is having with himself or herself, and then with the immediate environment and other social agencies. So when we try to see these trajectories comprehensively, then that is broadly becoming part of the larger healthcare behavior of the persons or the individuals. Now, When we talk about healthcare behavior of individuals, then that is strongly influenced by the overall culture which is prevailing, or the health culture which is prevailing. Some cultures may favor traditional healers or home remedies, while others may prefer Western medicine or a combination of both. Now, depending upon the kind of norms and values, or the kind of engagement that people have among themselves, depending upon that, their preferences for a specific type of health behavior or healthcare behavior may happen or occur. And so the study of healthcare behavior is important. One very important point that we need to talk about here is this, that cultural stigma is associated with certain illnesses or treatments. Because when we talk about illness or treatment, then that is not such a simple process. Because very often certain diseases are considered as a kind of social taboo, or there is a kind of stigma, negative sentiments attached with that. So people often want to not to disclose that kind of illness or sickness in public. And when that kind of thing is happening, then the treatment or the healthcare behavior in those situations get constrained by number of things. That means considering health behavior or the choice of seeking treatment is actually constrained by multiple factors, and some of these could be as extreme as getting stigmatized also. Because there was a time when tuberculosis was considered as a disease which had some sort of stigma. Very often the communicable diseases were considered extremely bad. Now there are several theoretical models and perspectives which developed over a period of time. And some of these models or perspectives could help us to understand the healthcare behavior of people in contemporary context also. The health belief model that developed in 1950s, that is relevant even today. Now it talks about certain things which are related to the perception of the people. Now this model is primarily influenced by the psychosocial approach, because it is dominated by the psychological approach also. This health belief model developed in the 1950s centers on individuals' perceptions and beliefs about health threats and their likelihood of taking preventive action. So if there are certain health threats, and if people realize those threats or health threats, then because of that, they are more likely to get involved in some kind of preventive action. So that perceived threat is working as an important factor for having a specific kind of healthcare behavior. This model basically emphasizes four key components: perceived susceptibility to a health threat, then perceived severity of the threat, perceived benefits of taking action, and perceived barriers to action. That means there are two important things. One is what kind of threat the person is perceiving about that problem, and then what kind of benefits the person is expecting if he or she is getting engaged in a specific kind of healthcare behavior. So it's a kind of uh, developing as some sort of equilibrium or trade-off. But if the threat or the perceived threat is higher, then the possibility of seeking healthcare would be higher. And if that threat is not so high, then people may tend to ignore that. right? That means they may avoid the specific kind of healthcare behavior. I've given an example here. An individual may decide to undergo regular health screenings if they perceive themselves as susceptible to a specific disease and believe that screening would be beneficial in reducing the severity of the threat. Just like that, smoking, people very often know that smoking is injurious to their health. It may cause a disease like cancer. But since they are not in that state of mind where they can see themselves as susceptible to cancer directly, they often ignore the threats related to that. So, this belief model basically helps us to understand situations like this. Then we have social cognitive theory proposed by Bandura in the 1980s that extends beyond the individual beliefs. So the first model we talked about the individual beliefs. Now this model goes beyond the individual beliefs and it encompasses the social influences and self-efficacy. According to this social cognitive theory, behavior is influenced by interactions between personal factors, environmental factors, and behavior itself. Observational learning, social norms, and self-efficacy are central to this social cognitive theory. So the core argument here is this, that people are not only influenced by their individual beliefs, but they also get influenced by interaction with environmental factors, personal factors, and the behavior itself, right? For example, an individual's decision to adopt a new exercise routine might be influenced by observing peers, engaging in similar activities, and feeling confident in their ability to succeed. So, if a person is seeing that other peoples are doing exercise and then they are keeping themselves fit, and if he is basically having some sort of interaction with the individual beliefs as well as the external environment, then he may also get a kind of understanding that if I also indulge in those exercises, I can also keep myself fit. And here the confidence will play very important role. So if he or she has confidence in his or her own ability to undertake that kind of exercises, then basically the cognitive theory will be operational and he or she will get involved in that kind of behavior. Then there is one more theory or model that is known as the theory of planned behavior. It is an extension of the theory of reasoned action and it was formulated by Azen in the late 1980s. It emphasizes the role of intentions in predicting behavior. The theory of planned behavior posits that intentions are influenced by three factors. So here they are talking about intentions, and these intentions are influenced by several factors, but they have mentioned here three important factors. What are these three important factors? One, attitude towards behavior. Second, subjective norms. And third is the perceived behavioral control. Right? Perceived behavioral control. So this way we can see this, that there are three important models, primarily the psychological models, which help us to understand the health behavior of people, or you can say that which help us to understand under which situations or circumstances people get indulged in a specific type of health behavior. So there are certain benefits and certain limitations. Now the benefits are there, that these models include psychological, social, and environmental factors, and they help in understanding the complexity of the health behavior. Now in the 1950s and then 60s and 70s, because we were not having enough information about the trajectory of health, so that point of time, these models or theories helped us to understand the health behavior of people, which was very important because we all know that the problems related to mortalities and morbidities were very high at that point of time. That was one important factor. And the second important factor was that the spread of medicine, healthcare was not so widespread at that point of time, and acceptance for the medicines, especially the western medicine, was again not that common. So these models helped to understand the health behavior of people at that point of time. Now, as we stated, those models primarily focused on the psychological modeling. Going beyond that, there are many socio-cultural factors which also influence the health behavior of people. So we have been talking about social determinants in multiple lectures, and the theoretical perspectives that we discussed earlier, those were also highlighting the impact of those social factors. So here I have briefly mentioned those factors. We will very briefly talk about these and then we will move next. So what are those socio-cultural factors which influence the health behavior of people? There are many. Socio-economic status is certainly very important. And what do we mean by socio-economic status? So people have different type of income, and on the basis of income they become or they come under different income groups, and on that basis often we identify classes, right? So income could be one factor and class could be another factor. Within the class people may have differential income. That is why we are considering income and class as two important categories. Then comes the very important category of occupation, and then the place of residence. Sometimes people live in rural areas, sometimes in urban areas, sometimes in metropolitan areas. So all these things play very important role in deciding the health behavior of people. For example, if we talk about occupation, then we know that there are organized sectors as well as unorganized sectors where people keep on working. Now, in the unorganized sector, there are different types of occupation that people are remaining involved in. But the kind of safety or security that people may need in a specific occupational environment may not be available in the unorganized sector. That means certain people who are exposed to certain types of occupations are also vulnerable to several other kinds of exposures which may cause some kind of disease, one side, and which may also restrict or constrain their exposure to the healthcare system. I'm giving you one example. Very often we see that the people who are working as daily wage worker, they often don't go to the government hospitals. I had conducted one particular study on migrant workers, and that time I have interviewed many of those workers, and when I had asked this question, then they stated that the government hospitals are basically operational during the daytime. So if you want to go to the government hospital, then there is a rush. We may have to stand there in queues, and then it may consume the whole day. So that way we will not be in a position to work in for that very day, and that way we may have to lose the wages for that day. So going to a government hospital is technically not feasible for us because we may have to take leave, and very often we are not given leave, or for that matter we may have to miss the wage for that very day. So that is a specific situation, a socio-economic situation which is creating a specific kind of constraint, and that is influencing the health behavior of people. Just like that, education is a very important factor. Those who are educated, they look at the things at a different level, and those who are not educated or illiterate, they are not in a position to basically think over the possible negative impact of the illness or the disease, or for that matter they may not understand what kind of preventive measures they may need to take, or for that matter they do not have the understanding of the promotive health. So level of education is a very important factor. And then gender, definitely gender is a very important factor. We all know about the gender differences and the kind of impact it may have on health. Women in general are having all those vulnerability related to disease or illness which men have. But along with that, they are also having one very important function which is known as reproductive function. Right? So because of the reproductive function and reproductive behavior, they are exposed to certain other types of constraints and situations. So that may create some specific requirements and at the same time some specific restrictions. And then when a society is patriarchal, that is male dominated, then it creates a specific type of constraints for the women. So there would be difference in the health behavior of the male as well as female. Just like that, age is also a very important factor here, because sometimes the elderly population have a very different type of engagement with the health institutions than what the other people are having, and especially the adults are having, right? Similarly, the self-care behavior is also operating in multiple ways. People do have different kind of exposure about hygiene or fitness or sanitation sort of thing. So how do people look at the immediate environment in terms of these important requirements related to good health? That plays very important role in the exposure related to various diseases, and especially in their approach to get treatment or seek health care. And then dietary behavior is again very important. Similarly, there is a very important term which is known as substance use, right? Often we are talking about substance abuse. Basically, the substance here is basically referring to those substances which are illegal, prohibited, right? Which are in day-to-day use. People also make use of the term drugs, right? Those are the prohibited things which are not safe for people without any medically justified reason, right? Or without any medical prescription. So very often those substances could be prescribed by some medical practitioner. But keeping aside those specific circumstances or situations, using those substances are very dangerous for the health of the person, and at the same time legal, from legal point of view also. But still we know that there are different practices related to substance abuse prevailing in almost all known human societies. So when someone is getting exposed to that kind of behavior, then that is technically creating a certain type of constraint in terms of the health behavior also. Just like that, sexual behavior is also an important factor. We all are aware of the problems related to the sexually transmitted disease or the sexually transmitted infections, right? And then we all have heard about HIV and AIDS, right? So the sexual behavior and the kind of exposure related to that is also playing very important role in the overall health behavior of people. And finally, people sometimes take unnecessary risks or sometimes get involved in the reckless behavior. So that is also creating some kind of threat and some types of constraints in their health behavior. So these were the socio-cultural factors which play very important role in the overall health behavior of people. Now we talk about another important term, which is health-seeking behavior. Now, what defines health-seeking behavior as any activity undertaken by individuals who perceive themselves to have a health problem or to be ill for the purpose of finding an appropriate remedy. So when people are basically seeking some kind of treatment, this is known as health seeking behavior. Then Castle and Cobb have identified three important categories of health behavior: the preventive health behavior, illness behavior, and sick role behavior. So some of these terms have appeared before also, and we have talked about these things, and these are again self-explanatory also, so you can read. Now we come to this slide, which is very important, because after discussing different types of health behavior or health care behavior or even health seeking behavior, we get to an understanding that people develop different types of health behavior or health seeking behavior, right? And because of that, people come in contact with different systems of medicine. So we have been talking about different systems of medicine in this week's courses, and those different systems of medicine are basically identified as medical pluralism. Now, one very important thing that we need to understand here is this, that the kind of engagement that people have with different systems of medicine varies under certain circumstances or certain situations. And those certain circumstances and situations could be used to understand the approaches towards healthcare or systems of medicine. So, on the basis of different types of health behavior that people have towards different systems of medicine, generally 4 or 5 approaches are identified, and I have mentioned those here: curative healthcare, preventive healthcare, promotive healthcare, rehabilitative healthcare, and palliative healthcare. We have been talking about some of these. For that matter, preventive, promotive, we talked about earlier also. Curative is also that we have discussed earlier. So, curative healthcare comes into picture when person is suffering from certain disease, and then a cure is basically sought. Now, this is popular not only in biomedicine but in also the traditional systems of medicine that we have discussed. Preventive is basically an effort to prevent the occurrence of the disease. So, what happens in vaccination? Basically, that is a preventive approach. Most of the traditional medicine also talk about preventive healthcare. Then promotive healthcare basically talks about promoting the capacity of the human body to fight with the disease, so that the body should have control over the disease or the body should not become sick. So we all know that human bodies have immune system. If the immune system is strengthened, then the body will not remain vulnerable. So promotive healthcare basically intends to strengthen the capacity of the body, or you can say the capacity of the immune system to fight against the disease causing vectors, right? Then comes the rehabilitative healthcare. Now, very often people get indulged in some type of disease where they might have needed long treatment. Then there might have been certain behavior change. There might have been certain restrictions. So once the treatment is over, then people do need some kind of support so that they can go back to their earlier position, so that they can have the kind of normalcy that they were having. And in those circumstances, basically they are in need of some kind of rehabilitative healthcare also. And then the last one here is palliative healthcare. Now, we are aware that there are certain diseases which cannot be cured, at least with the kind of treatment system that we are having as of now. For example, when cancer reaches to a very advanced stage, then the medical practitioners know that it cannot be cured completely. and this is very painful. The advanced stage of cancer is again very painful. So at that point of time, often it is suggested that some kind of medication should be done in such a way that at least the patient should not suffer from the kind of pain that he or she might be having, or he or she should live the whatever remaining part of his or her life is with some kind of uh, better experiences. So some kind of care is required, some kind of medication is required, and that type of approach is generally known as palliative care or palliative health care. So different types of health behavior could be identified in through these approaches, as we generally talk about. Then we come to the final point. Here I have mentioned what kind of engagement basically health behavior is having with medical pluralism. We have already discussed most of the points. So we will just have a look on these points. And if there is something important, we will talk about that. People often have a specific engagement or association with a specific system of medicine due to their specific cultural background. Yes, we have understood this point. Then different types of medicine and systems of medicine are developing in different parts of the world. We have seen that all the traditional medicines basically find their origin in specific geographies in different countries. Then migration have caused diffusion of systems of medicine as well as health behavior. Now this is a point that we have never discussed before, and this is very important. Why do we talk about spread of medical pluralism? Because there are two, three very important factors here. One is this international migration or migration within the nations also, right? So because of the increasing movement of people or mobility of people, people have reached to a new political space or a new geographical space, but because of their familiarity with a specific kind of treatment system, they also want to have that kind of treatment system in those other parts of the world or the nation. So if there is no provision of having access to those specific systems of treatment, then people will definitely have certain problems. So this is basically causing the spread of the traditional medicines or the other systems of medicine to different parts of the world or different parts of the country, in whichever context basically we are trying to look at. That means migration and then globalization have played very important role in strengthening the and spreading the concept of medical pluralism. Then traditional and ethnic medicines are emerging as complementary and alternative medicine because of certain limitations of biomedicine. Now, this is again important. During COVID, we have seen that many people were not very comfortable with the kind of medicine that biomedicine was providing. Although people were very comfortable at a later stage when vaccines were available, but during the initial stage, people went for making use of several types of alternative, traditional, or even home medicine, right? So as per the requirement of the situation, people often change their behavior, and because of that kind of thing, we are basically making use of different types of or systems of medicine. Very often, people also have engagement with multiple systems of medicine at one point of time. Basically, that kind of thing needs some sort of consent from the practitioner of that medicine, because that is very important. But very often we see that people are making use of those things. Maybe they have taken some kind of consent from their medical practitioners. And last but not the least, the functionalists, the Marxists, and the interactionists see different reasons for prevalence of medical pluralism. In very few words, I would say that functionalists think that the existence of multiple systems of medicine is basically very helpful in pluralist society, because every group of people have access to some system of medicine. That is their point of view. On the other hand, the Marxists see some kind of hierarchy within these systems of medicine, and they are a critique of this type of system, multiple systems of medicine, because they think that it helps in perpetuating the kind of hierarchy which is already existing among the people. And then we also have the interactionist, and that point of view is very important. Very often we see that people who are sick, they want to have some kind of personal communication with the doctors or the practitioners, but very often biomedicine is depending largely on the reports, lab reports, then certain type of scientific inquiries, etc. They are not much involved in having some kind of personal dialogue with the patient. So a communication gap is often coming into existence if we look at it from the phenomenological perspective. So that is also one important factor for which those people go to those practitioners who are more personally involved, or who are more personally engaged, or where they find some kind of more personal engagement, right? So these factors do play some kind of role in propagation of medical pluralism in contemporary society. So we have completed the course for the third week. I hope you understood all these points very well. And before we close, here is a think about this problem and an activity question. These are self-explanatory. And with this, these are some of the references that we have used. So take care. We will meet in the next lecture, and there we will start our course for the fourth week. Take care. Bye.